Hi, I'm Taylor Smith, and this is my overall J2 clinical experience. So, I was at St. Luke's Woodlands through the SNAPPy program with Professor M. She was a great professor, and I loved every second with her. So, one thing that I expected going into clinical was just to learn a lot from my preceptors that I have throughout St. Luke's. I had a great experience last year, and I kind of expected the same thing going in. So that is what happened. I had a great experience. Something that was better was actually Professor M. She made the entire clinical experience so very fun and welcoming. She made sure that what we were learning in class, that we could apply that knowledge into the clinical setting through case studies and questions that she would ask us during our midday meeting, which made it so helpful for when we did eventually have those patients in the clinical setting. Something worse, I have no notes. The preceptors were great. The staff was great. I had such a good time learning and making sure I kept up to date with my clinical skills throughout this entire clinical experience. So, the main thing that I learned through this clinical experience, besides just my nursing skills, was communication. Not with just the nurses and the patient, but also with staff outside of the primary care. I got to communicate with the doctor, PT, and respiratory therapy. I even got to communicate with nurses on different floors. I had a patient that I went to cath lab with, so I got to talk to the cath lab nurse, the PACU nurse, anesthesiology, and the doctor itself, which was very helpful in learning new skills and communication skills. Plus, each one of those people taught me something new that day, which was very, very helpful, even though they weren't my preceptors. They taught me so much. And that's why I think it's the biggest thing or the main thing that I learned from this experience is the communication skills, which are a major part of nursing. How will I apply what I learned in clinical practice? Communicating with just the doctors is a big part, making sure that I understand what's going on in the patient's life and their problems, but also and how to communicate to the doctor and other people on the floor. Plus my nursing skills in general. If I can apply those throughout my clinical experience, I got to do my first blood draw. And I got it first try because of the help from my nurse. He was able to show me and make sure I gained all the knowledge that I needed. He taught me so many skills that I needed to know and how to do it in a proper way for both myself, for my own safety, and for the patient's safety and comfort, which was real helpful and will help me a lot as I progress, not just through this nursing program, but as a nurse and further on in my career. And what ways did the clinical setting enhance my nursing education? It just taught me so much. It taught me how to be a better nurse, to look at the small details. I had a nurse one day quiz me on stuff I didn't even think about. There are so many small details that if you miss, you can harm not only yourself, but the patient, and because those small details matter in every ounce and aspect of that patient care. Because without the small details, you might even miss the big picture. Um, and how did this positively impact the organization or community? It just makes sure that safety and the patient safety and comfort is number one. This helps so much and kind of helps spread that we as nurses know what we're actually doing to make sure that we get the best possible outcome for the patient in every way possible. I really could not have asked for a better clinical experience. It has truly shown me so much. Plus, my professor was so awesome. She taught us so much, and every nurse, especially on the third floor of which she works, had such high things to say about her. She has taught us so much. I really could not have asked for a better clinical experience or a better clinical professor throughout my experience here at St. Luke's.